Hello everyone, and today we are going to talk about cardiovascular health, why it is crucial for our overall well-being and how we can easily improve it. Additionally, we are going to explore how we can measure it, and we're going to cover VO2 max as well, which is really important indicators for cardiovascular fitness. All right, so let's jump in. So why is cardiovascular health important? So cardiovascular health refers to the health of our heart and blood vessels, which are responsible for pumping oxygen-rich blood to all parts of our body. It is a critical aspect of our overall health and well-being. I mean, if we don't have oxygen pumping around our body, we don't exist. And obviously a healthy cardiovascular system ensures that our organs and tissues receive that necessary oxygen and nutrients for optimal functioning. Maintaining good cardiovascular health is crucial because cardiovascular diseases such as heart disease, stroke, and high blood pressure are all leading to death globally. There's several risk factors, which include things like unhealthy diet, sedentary lifestyle, smoking, excessive alcohol consumption, stress. There is some genetic things in there as well, which can all increase the risk of developing these cardiovascular diseases. However, I do have some good news. Adopting a heart-healthy lifestyle and making positive changes in our daily habits can actually reduce that risk significantly. So it's not all doom and gloom. So they are the health of the heart and the blood vessels responsible for pumping oxygen-rich blood to all parts of the body. So we're going to be going into some areas about how we can measure our cardiovascular health. So there's several ways to measure improvements in cardiovascular health. And here are some common methods. So we've got things like physical fitness tests. So performing a physical fitness test can provide valuable information on your cardiovascular health. So there's things that you can measure. So like aerobic fitness, you can do some form of like cardiorespiratory endurance tests, such as like a mile run to see how you can improve that mile run. Like a 12-minute walk run test, or like a step test, or things like a bleep test. These tests measure your ability to perform prolonged moderate to vigorous intensity exercise and can help assess improvements in your cardiovascular fitness over time. So I can talk about my own personal test that I'm doing right now. There is a 5-kilometer trail very close to my home that I am planning on beating the time every single time. And when I beat that time, that's obviously me improving my cardiovascular health because I am pushing myself and I'm trying to keep that heart rate high. You can't just go for an easy walk or like an easy run or whatever it might be. You do need to try and get that heart rate high and keep it high for as long as possible. And then you just repeat the same thing over and over. You can also look at your vital signs as well. So monitoring your vital signs such as heart rate, especially resting heart rate, blood pressure, and like generally heart rate overall. Lower resting heart rate and blood pressure are generally associated with better cardiovascular health, but obviously there will be some points where your heart rate might not necessarily want to be that low, and it could be caused by underlying medical conditions, but that is in the rare side of things. So having lower blood pressure and a lower resting heart rate generally is better, and most fitness watches do monitor your resting heart rate, so it's a really great way to see how your cardiovascular health is improving. And blood pressure monitors are super cheap from pharmacies if you wanted to check your blood pressure as well. Regularly checking and recording these values can help you track your changes and improvements in your cardiovascular health. You can go to the doctor and get blood tests, and they can provide important information about your cardiovascular health, such as measuring your cholesterol levels. This can assess your risk of developing cardiovascular diseases. Obviously, having regular blood tests can track these changes in these values, and improvements in your cholesterol levels can indicate better cardiovascular health. unless you have an underlying health condition or high cholesterol naturally, I wouldn't recommend you go and bug your doctor so much. I would probably focus on looking at your blood pressure and heart rate if you are wanting to look at vital signs of your body. Another thing you can do is cardiac imaging. So obviously this does result in you having to be referred for this kind of thing, but imaging tests such as echocardiography or stress tests can provide detailed information about the structure and function of your heart. These tests can help assess improvements in cardio health, such as improved heart function, reduced heart size, or better blood flow to your heart muscle. One of my favorite things is actually self-assessment. So paying attention to your own physical symptoms, how you feel during exercise or physical activities, can also be an incredible way of assessing your cardiovascular health improvements. So, for example, if you notice that you can perform an exercise with less effort, experience less shortness of breath, or have increased stamina, it will indicate that you've improved your cardiovascular health. So if you have a hill that's close by your home and you've been continually walking up it, and after 2 weeks you feel like you can get up there without being out of breath anymore, or you're less out of breath or less tired or whatever it might be, that is a good indicator that your cardiovascular health has improved. Even though you can't particularly measure it with numbers, we still need to really make sure that we are looking at how we're doing in terms of feeling. And then another thing you can do is tracking exercise performance. So keeping track of your exercise performance, such as duration, intensity, frequency of your workouts. They can all assess improvements in your cardiovascular health. If you are able to progressively increase your exercise capacity, such as running faster or longer, lifting heavier weights, or performing more repetitions, it might indicate improved cardiovascular health, or just general fitness has been improved. So another way that you can look at your cardiovascular health is understanding your VO2 max. And fitness trackers are showing VO2 max a little bit more now, with not much information on what it actually means. And I'm not entirely sure how accurate the cheaper what they're called, cheaper like watches, wearables are. But at the same time, if you're doing the same thing over and over and it's measuring the same thing, it will be measuring your cardiovascular health and the improvements there. So VO2 max is a measure of the maximum amount of blood that your body can use during exercise. It is considered an important indicator of cardiovascular fitness, as it reflects the efficiency of your cardiovascular system in delivering oxygen to your muscles. It is typically measured during a graded exercise test, where you can exercise on a treadmill or stationary bike while your oxygen consumption is monitored. So you might have seen pictures of people with the face masks on and doing the VO2 max there. However, it can be tested using your watches as well. The higher VO2 max indicates better cardiovascular fitness, and regular exercise can improve your VO2 max over time. VO2 max is when you are pushing yourself hard. So if you aren't getting your heart rate up and you're not feeling out of breath for a considerable amount of time, then your VO2 max probably won't change too much. I do have a chart here just to give you an indicator of VO2 max charts for women, and kind of where we should be in terms of our age bracket as well. Do not worry if you are in below average, poor, or very poor right now. That's completely fine. It's just an indicator for you to actually work on improving. As I said, if you are tracking on fitness watches, I would take it with a pinch of salt, and if it doesn't change too much, I wouldn't worry too much. But I do want to make sure that if you are wanting to track your VO2 max, it does change when you are out of breath, your heart rate is high for a considerable amount of time. It's not just being out of breath for like 30 seconds to a minute. You do need to try and keep that heart rate high to actually make sure you are measuring your VO2 max. So how do you improve your cardiovascular health? So the good news is that there are several simple and effective ways to improve your cardiovascular health. And I'm just going to go over some practical tips that you can incorporate into your daily routine. So this kind of is self-explanatory, but engaging in regular physical activity, especially cardiovascular activity. So regular exercise is one of the most effective ways to improve cardiovascular health. I would like you to aim for at least 150 minutes of moderate intensity aerobic activity, such as brisk walking, cycling, or running every single week. Even short bouts of physical activity, such as taking the stairs instead of the lift, can make a big difference. If you're currently not at 150 minutes and you're like more at 0, then I would look at working up to that 150 minutes. But I do think that the majority of population can get in a brisk walk throughout the week that adds up to 150 minutes. The second is following a heart-healthy diet. So eating a well-balanced diet, which is rich in fruits, veggies, whole grains, lean proteins, healthy fats, can improve your cardiovascular health, and limiting your intake of saturated trans fats, cholesterol, and high salt and added sugar will actually help with your heart health. Avoiding things like smoking and limiting your alcohol intake. Smoking is a significant risk factor for cardiovascular diseases. Quitting smoking is the best thing you can do for your heart health. Additionally, excessive alcohol consumption can raise your blood pressure and contribute to other cardiovascular problems. If you do choose to drink alcohol, do so in moderation. If you do wear a fitness tracker or a watch, then I would recommend, if you do drink, have a look at what your heart rate does after you've been drinking. It stays pretty high and your body will stay in stress for longer than when you were drinking. So that just gives you an indicator on the pressure it puts on your heart. So I would avoid having alcohol all the time. Managing stress and sleep is super important. High levels of stress can negatively impact your cardiovascular health. If you've ever felt like anxious, that kind of thing, you know that what it feels like in your own heart. And finding ways to manage your stress, so such things as practicing relaxation techniques, meditation, engaging in hobbies you enjoy. And then also we want to think about ensuring that we're getting enough sleep as well, because sleep in itself is a super important thing for our health, but also having enough sleep reduces the stress in our bodies. Another thing you can do if you are worried about your cardiovascular health is getting regular checkups. Regular checkups with your healthcare provider can help detect and manage any risk factors for cardiovascular diseases, such as high blood pressure, high cholesterol, and diabetes. I would recommend that you follow your recommendations from your doctor on your screenings and medications. But if you do want to monitor your own resting heart rate, your own blood pressure, that's going to be a good indicator for you to pass on to your doctor, or just use it if you aren't wanting to go to the doctor. So with the next steps, I want you to ask these 2 questions. Ask yourself these 2 questions. Are you currently happy with your cardiovascular health? If you aren't, then why not? And also, what steps are you going to take to improve it? So I want to make sure that we are making sure we're putting some steps in place to improve our cardiovascular health if you're not that happy with it. If you are happy with it, then I would encourage you to continue with improving it and just pushing yourself further and further to improve your fitness. So cardiovascular health is crucial for our overall well-being, and adopting a heart-healthy lifestyle can significantly reduce the risk of cardiovascular diseases. Simple lifestyle changes such as regular exercise, healthy eating, avoiding smoking and excessive alcohol intake, managing stress, and getting regular checkups can go a long way in improving our cardiovascular health. Additionally, understanding and improving your VO2 max can be a useful tool, but obviously all the other measuring techniques as well, to ensure that we are assessing your cardiovascular fitness levels too. So let's take some proactive steps to prioritize our cardiovascular health and lead a heart-healthy lifestyle.